Good morning. Tomorrow is May 1st, May Day, a day that celebrates workers here and around the world. And so we're back with our show, People Are the Economy, to help make sense of what the headlines really mean for our communities. Today, we see now that 30 million Americans are out of work. Imagine 714,000 people losing their jobs every single day. Now, as we celebrate and demand defense for workers, we also know that communities of color are reeling from the effects of COVID-19. The numbers show dire disparities in infection rates and deaths between races. They also show us the cracks in our public health, economic, and political systems. So let's name some of those systemic cracks. Unemployment hits different racial groups differently because of things like occupational segregation, discrimination, and other labor market disparities. Now, historical relationships suggest that an unemployment rate of 20.5%, this is the number that the Economic Policy Institute estimates might be the figure as we talk today. 20.5% unemployment would translate into a white unemployment rate of 18.4% and a Black unemployment rate of 36.8%. So with those stark numbers, today we welcome two guests who can speak to the ways that communities of color are being left behind. Elisheva Johnson is Executive Director of Michigan Liberation, an organization dedicated to the leadership development of community members and the creation of effective campaigns to advance racial, gender, and economic justice in Michigan. This pandemic has directly impacted Michigan's Black population, making the state initiate a coronavirus task force on racial disparities led by Lieutenant Governor Garland Gilchrist. This task force will specifically look into how race affects infection and death rates. But Michigan Liberation was well aware of the racial disparities before COVID-19, and I'm looking forward to hearing about what Michigan Liberation is focusing on right now in this time of magnified need. Our second guest is Dr. Seft Hunter, the Director of Black-led Organizing and Power Building at Community Change and Community Change Action. Seft helps us keep our finger on the pulse of trends and gives us insights into which factors are disproportionately affecting Black Americans as they navigate this pandemic. He will also explain the demands that the Black Freedom Collective, which he leads, want to see implemented at the federal level. So we're so grateful to have both Seft and Miss Johnson, the Executive Director of Michigan Liberation, here with us today. And I want to start with you, Seft. Tell us how COVID-19 has changed the fate of communities of color in America. And what do we know about the triple crises of coronavirus that have affected Black and brown communities? And when I say triple crises, I mean the public health crisis, the economic crisis, and the crisis of our democracy. So Seft, talk to us about what's happening in terms of communities of color.
Hey, thanks, Dorian. Good morning. And again, thanks for the invitation to join you and join you live this morning. I think we've been waking up over the last several weeks with basically a number of statistics that point to the significant disparities between Black and white communities across the country and how each of our particular communities are impacted in disparate ways, right? And so in Michigan, for example, the unemployment rate just a few weeks ago was at like 4.1%, where at the same time, the Black unemployment rate, for that matter, was almost twice that number. And that is not considering the racial disparities that exist in pay, as well as that exist in working conditions. My colleague here, Elisheva from Michigan, will speak to this a little bit more. But when we look at, for example, additional indicators, so in Detroit, the city of Detroit, who we know has been significantly adversely impacted by the coronavirus, and a large number of Black residents leading the way, unfortunately, of those who are perishing as a result of COVID-19. Just a few weeks ago, a report was published in the Detroit Free Press that pointed to a life expectancy difference between Black and white communities upwards of around 17 years. And this is directly attributable to the vast disparities that we see in both the social as well as the economic conditions between Black and white people in that city. Detroit is by no means, Dorian, isolated in this case. We see similar statistics and similar outcomes across the country. We've seen also recently a number of reports highlighting the underlying conditions that give rise to some of the significant outcomes, the significant disparities we see in those who are most likely to perish when we come in contact with the coronavirus. And so for Black communities, issues like hypertension and asthma and diabetes were far more prevalent in our communities than in any other community before the emergence of the coronavirus. And I think in some ways, this helps to explain some of the disparate outcomes that we're seeing in our communities. I would just say, in short, when we look at the emergence of this crisis, on top of other crises that our communities never recovered from, what we are seeing is the significant health and economic outlook of people of color rapidly declining at a time when we were already struggling to recover from the 2008 crisis and crisis before that. And I think precisely, Dorian, this is the issue that we need to address with the kind of urgency that it demands going forward.
So Elisheva, talk to me about how you or your family or folks you know have been affected by COVID-19. We hear the numbers, they're stark. We hear the unemployment numbers, we hear the racial disparity numbers. But Elisheva, talk to me about how this has affected you personally.
Yeah. So thank you, first of all, for inviting me to this wonderful show and letting me, lift my voice today around, what's going on here in Detroit. I actually had COVID myself and was able to get over it. And there is a huge, huge community of Black folks that have seen dozens and dozens of numbers of folks that have, that are not here anymore with us. And it's particularly a small group of, I don't know if you all know, but Detroit has a very rich history of ballroom dance. And that social group was hit very, very hard just because it's such a part of our community. And I caught COVID from someone who just loved to dance. And a woman, one of the first women who passed away here, we hired her brother on our canvas team. Instead of doing phone canvassing, we found many other ways to do the work. Instead of doing door-to-door canvassing, we've decided to do phone canvassing. And he's on our team because, this has hit him really hard. So when I'm talking about this and giving numbers, we actually have been hit ourselves and know people in our community and people that work for us that are losing family and friends every day. So I'm going to share with you all some information from our neighborhood defenders services and some things that we've been working on. They do 25% of our public defense here and in Detroit. And one of the things that we've been really working on is this whole narrative around who should be out. And I think one of our big issues is getting the community to really understand that people aren't really quarantined when they're in the jails and the prisons. Because I think that is the narrative that is out there. It's oh, they're already locked up. They're already away from us. They have this thing and we don't want people to come back out here with us. And I think that that's just a mistruth. And actually, those folks are sitting ducks and they had COVID brought into them. It wasn't there at first. So I'd like to be mindful as I share these numbers with y'all. But our neighborhood defender's office, because of that that group that was put together by our lieutenant governor, there's been real resources given to building smaller teams throughout the community, and we lead a couple of those teams. And so the numbers that Detroit handles is again approximately 25% of the felony cases in Wayne County, annually about 5,000. And we began tracking this data on March 16th. And so out of custody, released to our community, we've had about 194 folks.
Wow.
Come out. And we have about 75 people on tether right now that were let out. We had one case dismissed. We had one that we had to retain counsel for, and we're really working on trying to get that person out. And we had one that we know of that is deceased. So pre-trial, we still have 118 folks that are in there, and in custody serving a sentence, we have about 14 people in there for that, and then in our MDOC, they're reporting 11. So a lot of people still need to be let out. Like they've decided that they have let folks out. Our prosecutor is being a bit discriminatory as she is letting folks out that she believes should be out, when we are saying that low-level offenders need to be let out. Mm-hmm. There is this whole thing that like our community is shut down right now. Mm-hmm. We are living in the middle of many pandemics because of this one. Again, we are the African American community suffers from a lot of underlined issues that are medical issues that we already were fighting against the injustice around, right? Mm-hmm. And so of course we're going to be hard hit. There's this whole narrative that Black people are the issue with COVID in Michigan, and that's another thing that is just not true. We're not getting the resources that we need to really combat this issue. And it's becoming a larger and larger issue amongst younger folks in our community who really don't understand and have been given wrong information. Mm-hmm. I'd like to address that. It's like there's a lot of Facebook nonsense going on where people are passing along wrong truths, right? I had a young lady call me the other day because our president is, just not, steering us in the right way. And I had a young lady tell me she was spraying her whole self down with disinfectant. Mm. And before she did it to her baby, she wanted to call me and see if that was okay.
So Elisheva, let me ask you a question on this point, because it's a really important point. There's guidance and messages from the White House and the presidential administration. Then there's other guidance and messages, some solutions from, say, state and local officials. I'm going to come back to you now. Talk to us about how the conflicting guidance that you've been hearing, how it's affecting Black folks in Detroit and around the state of Michigan. And then Seft, I want you to answer that question too, of how do we make sense of the conflicting guidance, whether from the White House or from state and local officials? How is it affecting Black folks? So Elisheva, say more about what you were just talking about.
So as we know already, it is just cultural for, folks who are oppressed to not trust government, right? And so things that we're hearing from, our White House, people are having to pick and choose bits and pieces of information that they're given. And, some people aren't making the right decisions. Mm-hmm. And when our leader just the other day made a comment about something about bleach or drinking disinfectant, some people took that as a truth and started to do research around like how they could protect themselves in that way. And that's just not true. And we're trying to put the message out that, this is dangerous to you and your loved ones, and do not do this. And then when something comes out, from our governor that is to keep us safe, folks are not wanting to believe that, because we do have supremacists that showed up because our government, sent them acknowledgement to do things like this and go against our governor who's trying to keep us safe. And they really fought for things that, oppressed people are seeing are like, oh, those are the important things, like golf and getting back out on their boats. And so people said, oh, we can get back out in community. And that's just not true. Mm-hmm. So like what we're doing right now is we're on a campaign to get the truth out. Mm-hmm. And we really, really need to get the right information out, safe information to people in the community who just don't trust right now what they're hearing.
Dr. Hunter, you are a public health expert in addition to a community organizer. Talk to us about how do people make sense and meaning of the conflicting information that's out there?
Yeah, and so to the point that our colleague raised, it's almost you need a full-time staff just to keep track of some of the statements coming from the president because it's overwhelming, right? But I do think, we have to look at multiple sources. And I strongly believe that policies in this particular case are moral documents in so much as they give us an indication of our values as a country, our values as a state, and our values as a community. I think they also give the best indication of who, to whom or for whom is this system working and for whom are we most concerned, right? And I think our colleague raised the fact of that our Black and brown brothers and sisters, are some of the folks who represent the largest segment of our population who are reflected in various states of incarceration and detention at this point. We know that roughly around 50% of those incarcerated are Black and Hispanic males. And we also know that looking at some of the initial evidence that it's precisely in those confines where folks face significant risk. So we have a number of folks who are in detention right now who will both contract the coronavirus and will die as a result of being in close confines in jails and other sources of detention. You mentioned Dorian, the Economic Policy Institute, and just a few weeks ago, they released a report showing that roughly around 20% of Black folks are in jobs that can be done from home. Right? And so the rest of us, the other countless millions of us, are either unemployed or we're in this new set of designated positions noted as essential workers, where we again are called to place our bodies on the line in service to an economy that pays us poverty wages, provides few benefits, and even fewer workplace protections. And so the fight for us at this particular point, as my colleague lifted up, is really looking at how do we shift the balance of power in favor of working people? How do we ensure that the folks in our economy for whom the government has never worked, for whom the government has never been responsive to our aspirations? The fight for us at this particular moment is to seize this opportunity to shift the balance of power so the folks in communities across Michigan and across the country have what they need to experience the dignity that comes from being well.
Yeah, Seft, it's not lost on me that just the data and the numbers, again, data is so important and good data is powerful. Majority of essential workers are women, disproportionate number of essential workers, those classified as essential workers, women of color. I think of particularly immigrant workers of Asian, Latinx origin in meatpacking plants that have been essentially sent into the factories to become infected and sick and die just so people can have food. So just how we're, it's May Day, right, tomorrow, and just how we're showing up for workers and especially workers of color and especially women of color is really important. So let's pivot to what do we do about all this, because the data is sobering. We've done this several weeks now in a row, and every week it's just absolutely sobering and depressing. So I want to pivot us to a little more optimism of what people can do to change things. So Elisheva, I want you to talk to us about what Michigan Liberation is doing in this moment to fortify relationships across social networks, people on their friend networks or families. What is Michigan Liberation doing to organize people in this moment?
So I really appreciate, Seth, you talking about pivoting, right? And I think that this is a really important time that we take and acknowledge all of the really great things that have come out of this, right? And one of the things that Michigan Liberation has been responsible for is just remember, those canvassers were once people who were going to be asking you who you were going to be looking to elect in our many upcoming elections. And now what we're using those folks to do is just ask people what it is that they need. We're making 90 calls per person. We have a 13 person team that makes about 90 calls per person a day to our communities, asking them what it is they need, what it is they're going through, and how can we help support them. And so many people, especially older, our aging population, is just really glad to get a call, right? Just to say, hey, we're making sure you're okay. Are you getting meals? And folks are just really, really rallying behind this. we're able to send them to resources that they need. People are really honest in this time. It's been really good to connect with the community in that way. My mom is a one of those protected people that aren't really protected, right? That essential worker that we keep talking about, but they're not being treated as essential workers. My mom is works in a nursing home facility, and she's already underpaid, and they are not being given tools that they need. So what they're doing and what we're helping support is them lifting their voices and sharing this with our governor. We're going to be doing an action very soon where we are pulling together our community and lifting the voices. And we're going to be doing that in the next couple of weeks, where we're getting our community out and their voices heard for things that they need, like what Seth was talking about. Like, you know, those people of color who are in situations that were already situations before this horrible thing happened to us, that's now being exacerbated by this health pandemic. So I really appreciate the things that you said, Seth. It's so really good to hear that there are other people in other states that are thinking about Michigan, and I really appreciate that from y'all.
So, Seft, I want to build on what Elisheva just said in terms of this moment of engagement and organizing. And I keep in my mind playing over and over the famous opening from Charles Dickens' Tale of Two Cities. It was the best of times, it was the worst of times. It's definitely the worst of times for so many folks in our communities. I think we're at over 61,000 deaths as of this moment across the country, disproportionately Black folks. Seth, talk to us about the opportunities, right, in terms of any silver lining in this moment of engaging people to take action to protect our communities and to change, actually, the policies that affect all of us.
Yeah, and I think that's right, Dorian. There is no easy way, as we all know, out of this. And I think that the kind of policies that we need, we have to be willing to fight for it, because there will be no other way in which we will land out of this crisis. Now, within the Black Freedom Collective, which is a growing group of leaders from across the country, we've put forward a framework for how we believe we can equitably respond to both the public health, economic, as well as the political crisis of this moment. And these are a set of common sense ideas our partners are demanding from their local, their state congressional delegations, governors, and other municipal leaders in the places where they organize. And so these ideas include things like, safe housing, access to healthcare, economic relief, testing for folks who have now been designated essential workers, but really are at significant risk. The need for increased testing for folks who are currently incarcerated, safe working conditions for workers. Dorian, we believe that this moment provides us yet another opportunity to point out and to understand the ways in which race still matters in our country, right? And as organizers, we know that we must have both the moral as well as the political courage to speak to this reality. While there is, there's often a reflex to pull everybody together, and I think that is admirable. The disproportionate impact of COVID-19 tells us that we are in fact not all in this together, right? Mm-hmm. And I think because that is true, we cannot have a solution, a response that pretends to be colorblind. Rather, I believe we must insist on policies that are truly equitable, that gets the resources to the people and the places in this economy who most need it. I think anything less denies the reality and really kind of prolongs the suffering that we're seeing right now.
Elisheva Johnson is Executive Director of Michigan Liberation. Dr. Seft Hunter is the Director of Blackwood Organizing and Power Building at Community Change. I want to thank you both for taking the time with us this morning. And please, if you're watching, share your stories with us. We have a campaign where you can join us in this movement for a bold, inclusive, and caring agenda. The link is in the caption below. Thanks for tuning in. Thanks again to my guest, and we'll see you next week.